be Vevai, it can be Vigashi or Ashugari. Any kind of potency can be used at that particular moment, and that will show the result. So that is what, so that is why we have to use the nasal root, Nasahi Shirasodoram. We use a nasal root for administering. We have a nasal cavity. We have to say that nasal cavity is having such a large space is there. It is a potential area for a space. There is a potential space is there. So if it is a potential space, so we can blow the medicine or we can put a drops. Only oil cannot be done in emergency, but drops or oils can be done, or powders are more fast penetrating. So this is a potential area. That is what Sringadaka Marma can be approached. So if you see the back of the palate, that potential drug will be working. So zones, vestibular zone, a turbinate zone, and olfactory zone. So different areas are there, back of the nostrils. It is hydrophilic. The mucus is hydrophilic. That means if you are using a powders, if you are using powder, it will penetrate very fast. And for an olfactory area, it is a sensory area. That's fine. It's all the back of the nasal cavity. I'm just skipping all those areas. So this is one particular area, Mastulinga Agama. So this is one area where you can direct. There is one area from the palate. There is a nasal palate. It's a cribriform plate, what we say. So that area is directly related with the brain. So that is one area where there is a communication between the brain. It's so near. So that is the nearest spot to the brain. And that's also one way the stimulus, because it is also medicine is not penetrating. I want to make it clear. It is not the medicine. It is a potency of the medicine. It works on this particular area as a stimulus on the cranial nerves. It's not the active principle. It is a potency. So that is a Sringadaka Marma. So what exactly was done on that particular area is just for the demonstration. It was like his hands was dragged. It was crossed so that we could put pore pressure. If I drag it, it is different. The crossing will give a on the Shipra Marmam. It was like pressed for like 3 or 4 times. It has to be dragged. The shoulder has to be dragged before we put the head. We work on the head. That dragging the hand is not really a technique which is taken from a Marma class. It is actually from a myofascial release. You have to release the shoulders. Then you have to work on the Marmas. And afterwards, cold is applied. After cold application, Nasyam with the cold has to be applied. So that is a actually they are kids, they don't know what exactly is happening. They are just worried, they just even don't know what exactly things are. So they just like. So that is why when you are practicing Kalari or Marma, definitely there should be somebody to supervise. If there is nobody to supervise, we end up in big troubles finally. We gave a nasal spray. Yes, it's actually the powder is there. We are just put in a nasal spray and we are just using a nasal spray. And afterwards, you can do a verbal communication. So that's so the mode of action, that is a powder. Okay, so what is this? Was a drug which was being used. That is a Shirovirejana Dravyas, what we called as like purgation for the head. So it contains the Apamarga, Shigru, Sarshapa, Lashuna, and Vidangam, Pipali, Marijam, Saindam. So I have used some. The Shigru is like the Moringa seeds is there. Apamargam is then the Gunja seed is there. Pepper is there. Long pepper is there. Black pepper is there. So these things are made as a powder, and this powder is made. So this is made as a basma. So usually this basma is made along with some like charring. So the expiry date is like 3 months. Afterwards, it doesn't work. Like a vibhuti. It is made like a vibhuti, but it is not exactly the same formula. And afterwards, the follow-up is done using Panchagavya Grida. So after finishing the thing, from the next day onwards, the person has to consume. After these therapies of the head and neck, we have to give him Panchagavya Grida as a consumption. And definitely Ayurveda say you have to go for the Mani Mantra Ushadhinam has to be considered. So definitely we have to suggest the Mrutyunjaya, such things has been diagnosed, we have to suggest the Mrutyunjaya Mantra or Mrutyunjaya Homa, or everything has to be suggested. So that is also an important part of this kind of management, especially epilepsy, such Manomaya, Kosha level cases. Definitely Mrutyunjaya Mantra is very important. So it's a very important part of like treatment is Mrutyunjaya Mantram, especially fear, ego, all the things. If ever we are discussing anything with the manas, definitely that will go with the Mrutyunjaya Mantra. People say it is a swasthya full rakshana, but it is mano rakshana. Mano is like the most important. The person has to expose to that, or they have to process the ghee. Or sometimes the thing is, what I want to say is the char of this, the alkali of this Mahamrutyunjaya Mantra which is made, so that is given along with the Panchagavya Grida for like 41 days. So that's management. So that is like the myofascia is one area which I was like specializing. But thing is, it is not studied only by, or either you have to do it by movement, you have to understand the fascia by kinesiology, by moving, or you have to do it by dissection. But thing is, dissection wise, it is very difficult to identify the myofascia of the body. It is very extensively. But now only the dissection, the modern science started doing different methods for that. So Tom Mayer, we can see anatomy trains by Tom Mayer. He is known as the father of the fascia. So I got some opportunity to work with him with some dissection classes. But so he is explaining about the facial releasing techniques. And the next part is by learning mechanical method, like how we are moving through Kalari from the teachers. Like so many teachers have many things to contribute to Marma. Thing is, it is very scientific. Honestly speaking, it is very scientific, but we don't need to prove it using a scientific method to say that this is scientific. Already it is scientific. Why should you again prove? I don't know. Just practice it, effect will come. But the thing is that first you come with the papers, you come with evidence that this is good, then we will practice it. That question is really out of focus. So thank you, madam, for giving this chance. Thank you.
Thank you, Dr. Madan, and extremely sorry for rushing you through this. It was a fantastic, talk. We definitely would have liked to have, had you for some more time and take some questions. But I think there's a cultural program which is going to begin very soon here. So we want to thank on behalf of myself and my co-chair, Professor Shankar Adluri. We would like to thank all of those who have attended the session and been here throughout. Thank you so much. And thanks for all the speakers who have come from down south to give these talks. Thank you so much, and we would like to felicitate Dr. Madan now.
And I would like to felicitate Professor Ramaja Sundar and Dr. Adluri for bringing in these speakers, organizing an excellent session on Ayurveda. This was the biggest special session of the conference, easily, and we really are grateful to them. Thank you very much.
So once again, I would like to thank every one of them, particularly the speakers who have come from all parts of the country and all the audience who have sat through this session. So while the preparations are going on, if there are any questions concerning the previous talks, because we could not take the questions for the last 3 sessions, I think we can have a 5-minute question and answer session. I request the speakers to be available for just 5 minutes. If there are any questions, we can take it. So any questions on the Varma and Marma sessions? Yeah, sure.
So I could just attend the last talk. I missed the earlier ones. So I had a question for you. So I mean, you've very well defined the Marma points here. So when you train as a Marma practitioner, right? Once the Marma atlas is known, what does it, like basically, what does the training consist of?
See, actually I was like planning like to make an atlas where we have Marma, Varma, everything has to be documented in a body, and from that we identify that particular region. Once you identify the region, one is you have to identify itself. Self is like how when you make your movement, suppose when you get your twisted, when your wrist is moving, you will identify that particular region. Right. So one is you identifying by yourself is a first hand identification of Marma is you identify is yourself. Right. Yeah. That is a primary thing. Afterwards, you can identify in the next person. So this is a primary. So when you do Kalari, martial art training and all, you are learning it yourself. Even when we go to Ashan, they are teaching us. They teach us. They first touch it on your. Sir, Ashan, what we say, Tottu Kaatamal Marmam Shuttu Pogiran. That's what Sir used to say. Means you have to touch and feel it. Right. Yeah. That is a thing.
No, so the reason why I was asking that, given that there are so few Marma practitioners, are there any, once we know the atlas, as a lay person, are there some simpler techniques which we can, do if something happens, or is it risky?
That you have to ask Ashan for that. Right. Okay, I am not a person to give that, but that question has to be asked to Ashan.
Yeah. So the reason I was asking this question was that given that there are so few Marma practitioners and this is such an effective technique, as a layman, are there any, non-risky, simpler techniques which we can,
According to this science, there are 2 channels. One is Amrita, nectar flow going here and there. Another one is Vishavota. Vishavota is a negative energy. You don't touch the poison movement. The Amrita Vatam you can touch. But you must understand the Amrita Vata related point, you can easily do. On the belly button you give a pressure on belly button which is connect with Amrita flow. That is every day you have to do the belly button press. The basic Vayu gets stimulated. Thank you.
So if there are any other questions, or we could conclude. So once again, I would like to thank everyone, all the speakers individually and all the audience for the patient listening. I'd like to thank the organizers, Professor Behra, Dr. Arnav for tolerating all our tantrums at odd times, and I thank all the organizers, all the students who helped us a lot. So thank you very much, and so we conclude our special session. Thank you very much.